we'll kick off this panel, which is to gain a sense of patient perspectives and what it's like to live with these two diseases. So to start us off, we'll just go across the panel, and can you tell us your name, what condition you're living with, and how long did it take to get your diagnosis, and what was that process like?
Hi there, my name's Sydney. I have MOG. I got sick in 2018 in October, and they figured out that I had transverse myelitis. But from the point in October when they figured that out, it took till January to actually find out that I had MOG. So a few months.
Hi, my name is Kaitlyn. I was diagnosed in January of 2021. I have seronegative NMOSD. I presented quite atypical with no pain, but I went from 20/20 vision to legally blind within a day. So it's quite aggressive. But yeah, so I started presenting December 29th, was in the hospital on New Year's Eve, unfortunately. And then I was very fortunate to get diagnosed within about 5 weeks after going through 2 different neuro-ophthalmologists. But now I am at St. Mike's, and that's where I got my official diagnosis.
Hi, my name is Alyssa. I was diagnosed I got sick in 2018, and they gave me the maybe diagnosis. I didn't get officially diagnosed until February of the following year. I presented with sort of everything but my eyes. I was paralyzed on my left side. I had the numbness, the tingling, vomiting, and the uncontrollable hiccups, which, if you ask me, is the worst of them all. And now I'm also at St. Mike's, and that's where I've been getting my treatment. Also, I was in Florida when I originally got diagnosed. I was not living here in Canada.
Hi, my name is Marissa. I have NMOSD. I'm recently diagnosed. My first attack was September of 2024. I had numbness and tingling on my right side, my face, blurred vision on my right side. I couldn't walk. I lost my balance. My initial diagnosis was, maybe we think you have MS. They did multiple MRIs and blood work. I had a lumbar puncture, and I was fortunate. I am up in Peterborough, but I was fortunate that the neurologist there is an MS specialist, and it was about 5 weeks when I got my official diagnosis.
Great. Thank you. Maybe you can tell me a little bit about what it's like living with symptoms, or not, day to day. What does a typical day look like, and what kinds of symptoms do you experience?
So in the typical day, I work 12-hour shifts, so I find that a schedule works a lot better for me. So usually I'll work 4 days on for 12 hours. And then on my 4 days off, it's usually really, really exhausting. Like, I'll end up spending the first day just kind of sleeping most of the day. I'm on rituximab, so I am immune compromised. So that's a bit of a struggle as well. But I find the thing that I deal with most is probably like the exhaustion and just getting tired. And I find that sticking to a schedule kind of helps with that. But at the end of the day, like, there's nothing really that I can do a lot for that. Like, there is pills and stuff, but I find that a schedule, like staying to that, really, really helps.
So I'm currently on rituximab. I was previously on Imuron, and I got a very rare drug-induced hepatitis. I woke up with jaundice one day. So that was very fun. So they obviously took me off of that, and they switched to me to rituximab. That was last Christmas. So I've been reacting really well to that medication. And I'm very fortunate that I don't have any day-to-day symptoms. It's mostly been, my struggles have been symptoms from the medication that I've been put on. But I'm in teachers college. I'm in a grade 3 classroom right now, lots of germs. I am immunocompromised. I wash my hands a lot. I carry hand cream everywhere I go. I try not to touch my face. I try to stay away from sick people, obviously, but I am very fortunate that it doesn't affect my day-to-day life too often right now. Knock on wood. I've been quite fortunate in that sense.
I think because I'm a student, I'm finishing my last year at York University. A lot of my day-to-day symptoms come from exhaustion of walking on campus, walking to and from classes. Don't tell the president of York I said this, but the infrastructure at York is not great because I'm still dealing with a lot of problems walking from my paralysis and the cobblestones at York because they try to keep it historic. It makes it very difficult. So I end up finishing the day with a lot of exhaustion, a lot of swelling on my legs, swelling in my fingers from typing for notes all day. And then you're in a third grade class. I'm at a university. They don't get any cleaner. It's just as dirty, just as germ filled. And so I'm also immunocompromised. I used to be on rituximab, but I relapsed on rituximab. So now I'm on Enspring and trying to keep my hands clean, carry my hand sanitizer. I struggle a lot with that also as a student. Sometimes you forget your hand sanitizers in your other bag, but trying to keep up with that sort of thing is a little difficult. But that day-to-day of swelling and pain, there's management options, but sort of, trying to keep it under wraps while still trying to attend class.
So when I first got diagnosed, and I was waiting for treatment, it was about a month. I had to take multiple doses of prednisone and so like 30 tablets a day, 50 milligrams, and it just went in and came right back out again. So I dealt with a lot of nausea and vomiting with that. I am on a newer medication called Uplizna. It's an infusion that I take every 6 months. The first dose was in November after I got diagnosed. And then you do a booster 2 weeks after. And then my frequency is now May and November. So I'm actually going for treatment next week. I've been pretty successful with that treatment. I have recovered a little bit with the paralysis on my right side. I do play pickleball still now. I find that helps with my mobility. I do still have numbness and tingling. I get these spasms where it feels like somebody's wrapping a belt around my waist and then pulling it as tight as they can, and then my legs go numb. So I'm taking carbamazepine for that. And so my day-to-day is a lot of fatigue. I work from home. Fatigue, sometimes numbness and tingling. If I'm sitting for long periods of time, I get numbness and tingling. Like right now, my hands tingling. When I'm driving, I'll get the numbness and tingling when I'm driving. I can't really walk even though I play pickleball, I can't walk uphill or stairs. Stairs, I have troubles with, like climbing flights of stairs. So that's my day-to-day. And then sometimes I'll wake up, which is a new thing for me recently, is waking up in the middle of the night and I have pain in my hands right to my fingertips. And it's just like, it's not like my hands asleep, it's just a lot of pain. So different things. This is my new normal that I'm learning to cope with.
Well, thank you for sharing that, and thank you all for sharing your experiences so far. For a lot of people here today, it's their first time meeting somebody else who's living with NMOSD or MOGAD. The next question is a bit of a segue from the last one, but for friends or family who are here, what would you want them to know about how it might be best to help you cope with your condition?
I'll start off. I get really exhausted, like everybody else. When they get really exhausted, they get really like irritated. So I would say I'm not trying to be mean when I'm being mean. And my mom knows this, and it's like a lot of trial and error because when I first got sick, I was 16. And so she kind of just thought that it was like the teenager, like, oh my God, I want to end this right now. But it wasn't. It was just a bit of like the not being able to regulate and things like that. I would just get irritated, or like I would just like completely break down about something. And she'd be like, Sydney, what are you doing? Like, this is ridiculous. And I'd be like, you just have to give me a minute because there's so much going on. Like, there's so much exhaustion. And like when I didn't really know how to deal with that, I didn't know how to deal with it. And it was really difficult because you'd get to these points where you just kind of like explode, and then everybody would be looking at you like, literally, what are you doing? Like, you're just trying to fold your laundry. What are you doing? And I'm like, it's not just that. It's not just that. Like, there's so much more going on. And I would say you have to just like be lenient and just give those people a breath because like at the time, like you can't really see it. Like they're dealing with a lot. And just like for me with like being exhausted and like having fatigue, it is a lot. And you just have to give them like that leniency and just realize that like it might not look like they're doing a lot, but they're really exhausted. And they just like need you to give them a bit of that grace because you have no idea. Like it's a lot at one time, and just asking them to just do something could just be like that thing that pushes it over the edge. And so if you're lenient and you kind of just give them a beat to just chill out, I feel like that really helps, especially like with my family. But yeah.
Yeah, so I can kind of talk more about the side effects of medication and kind of what I went through. Obviously, I know a lot of you, probably everyone here has been on prednisone, the devil's tic tac. You know what that can do to your body. And I remember just the lack of sleep, not being able to sleep, and how frustrating that was, and how you want to sleep, but you're just so wired. And also like I had crazy mood swings, and my poor parents, they they took that on the shoulder really well and knew that, that's not really me. That's the kind of the medication talking. So you do need to have a lot of patience when we're kind of going through new medications and trying to figure out our new life on this medication. The emotional side of that, I experienced lots of weight gain. I gained about 60 pounds in 3 months. And that was devastating to me. It took like an emotional and physical toll on me. My body looked differently, and I didn't recognize myself when I looked in the mirror. That was, I think, actually harder than my diagnosis, to be honest. It's just when you don't recognize yourself, that was really hard. So yeah, I was going through a lot. On top of not being able to recognize myself and going through this whole diagnosis process and being frustrated, and I became pre-diabetic because of the prednisone, and I was getting weird symptoms like ingrown toenails because of the extra weight on my feet. All these little things just added up, and it was really overwhelming. And throughout this, I was also in school and university getting my undergrad at Toronto Metropolitan University. So I was under a lot of stress, and my mood swings, my poor parents. I thank them all the time for being so understanding. And so just a lot of patience and understanding, and knowing that, they're just going through a hard time. And if, they're upset with you, it's not you, it's, their mental process and what's going on in their head. And it's just, really hard. So just patience and understanding and love, of course.
I hate to be that guy, but my response is going to be very similar of giving your loved one grace. Again, I also had the mood swings. When I first got sick, I was 17. By the time I was in the hospital, I was 18. It was literally weeks after my 18th birthday. And I think my parents kind of chalked it up to like, I know you're stressed, but imagine how stressed we are. But like feeling it is different than seeing it. I hate to say that, but it is. I know you're stressed as a caregiver, but understanding that we are also stressed having to deal with that. And me currently being in university, balancing that, and my goal is to go to law school, which is even more stress. That would combine with the mood swings and the side effects from different drugs. I also gained a lot of weight on prednisone. I gained almost 100 pounds in 4 months, give or take. And I'm still trying to lose it. So that idea of not being able to recognize myself, as you said, like, especially at such a young age, you know, you see your friends going off and doing this and getting married, you know, and you still feel very sheltered, I guess you could say, especially being immunocompromised, like during COVID. You know, COVID didn't end in 2020 for us, you know, COVID lasted and is still lasting. So that sort of idea that I can't go to certain places as my, you know, my friends, and that, so taking that frustration out of on those close to you, like I'm sure my parents have heard me combat them. I get very snippy sometimes. So I think it's the future lawyer in me. And that sort of arguing back and forth, it's not you. So just take it with grace, and understand that, like, sometimes I don't mean it. Sometimes I do.
I think a lot of people will look at us and say, "Oh, there's nothing wrong with you. You know, it's a silent disease. Like, you know, we may not look physically disabled." I think education and learning about the disease. Like, my mom thinks I'm so fragile that I can't do anything, and like being able to keep going and fight, and even though our daily normal is different from everybody else, we're still going. You know, we keep going, and just understanding that, you know, just because we don't look physically disabled, you know, you don't have to treat us like we're gonna break. You know, and I think that's one thing for me, just, you know, allowing us to breathe as well, you know, and learn our new capabilities and stuff. Like, with me being fairly new too, it's just like I'm still learning about my symptoms, and I'm still like, I wake up and a lot of it is anxiety for me. Anxiety. I was really depressed when I first got diagnosed. I was going through depression, tons of anxiety. Like, what's going to happen to me? What's my future going to look like? Am I going to die? You know, I made my funeral arrangements when I first got diagnosed. Yeah, so just a lot of empathy.
Thank you so much for sharing that. This next question I don't know the answer to, so I'll see if it resonates with you. But NMOSD and MOGAD, seronegative, seropositive, long titles, rare diseases that sometimes people haven't heard of or don't know what you're talking about. Has that impacted your journey at all in terms of getting a diagnosis or now living with a diagnosis where people aren't familiar with what you have?
I'll say I was very fortunate when I first got diagnosed to be with such great, amazing doctors, and I still am. Dalia Rotstein is my doctor currently. When I first got diagnosed, I was at SickKids, so I had Dr. Ye, and she was fantastic. I cannot say enough positive things. But before she diagnosed me, I was at a hospital in Scarborough, and they actually wanted to send me home because they thought that I just had fatigue and I just had the flu or something. And then I almost died. So it really wasn't great. I got transferred to SickKids a few days after being at Scarborough. And it was really, really horrible. Like, they ended up having to tell my parents that I might not make it and all this other stuff because nobody really knew what was going on. And I can't fault anybody for not knowing because it's so rare. It's nobody's fault at all. But yeah, I would say that's a little bit of maybe the difficulty. And maybe sometimes still with family doctors and stuff, when you try to get prescriptions for stuff, you're like, hey, XYZ is what I'm dealing with. And they have no idea because they've never dealt with people that have rare neurological things going on. And again, it's nobody's fault, but advocacy is really, really important. I will say that if nobody's going to advocate for you, it's just you. You're the only person that's going to be there. So you just have to make sure that you're advocating and you know what you need.
Yeah, that's a good answer. For sure, advocacy is super important. Getting that word out there. When I first started presenting my symptoms, I went to Trillium and doctors had no idea what was going on, especially because I was atypical. And turns out, my optic nerve, I had optic neuritis, but doctors couldn't see when you look into my eye, you can't see the damage, right? So they had no idea. And then I had no pain as well. So that didn't help. So I just had the vision loss and they had no idea what was going on. And I was referred to a neuro-ophthalmologist, which was the right step, amazing. And I saw him the very next day on New Year's Day, January 1st, 2021. And he had no idea. He was straight out of med school, quite young. So this would have been, completely out of his zone. And he had no idea. He was testing me for something called LHON. It's Leber's hereditary something. It's mostly in men, but they said it, rare case, but I didn't have any family history. So it didn't quite make sense, but he was trying, but there was no treatment plan for me. He kind of just said, well, it could be this. You could lose your vision in your other eye. If it does, give me a call. And I'm like, okay, great. So that was not a good doctor's appointment. I was sent home going, well, I might be blind for the rest of my life. It might get worse. It might spread to my other eye. When it did, I called him and he was on vacation and told me just to go to the ER. So that was very scary. But luckily, in my case, I have a friend in Germany, and she used to be a nanny for a doctor in New York City, Dr. Sam Parnia. And he was very interested in my case, and she told him about me and he wanted to talk to me, and we were doing Zoom calls, and he said, I'm going to help you in any way I can. And he was talking to colleagues, and he said, if anything changes in your health, please call me. So I gave him a call that day that I woke up when it had spread to my left eye. And my optic neurologist was on vacation. So he said, okay, give me a half an hour. So he called me back 20 minutes later and said, I got you an emergency appointment at the Kensington Eye Institute, downtown Toronto. And he was like, I have an appointment for you. So he pulled some strings, and I was very lucky that I had that connection. And through that doctor, she was a specialist in cataracts. So this was also not her field, but she said, I have an amazing neuro-ophthalmologist who runs out of St. Mike's, Dr. Not Muchili, she's my neurologist, but Dr. Michili. Very similar names. Yes. Yeah. So they sent me to Dr. Michili, my neuro-ophthalmologist at St. Mike's. And he said, I think I know what you have. I need you to have an MRI for me to confirm it. Within an hour, I was in my hospital room getting an MRI, and he called me back that night saying, I know what you have. And then that's when I was referred to Dr. Muchili, my now neurologist, and I got my plasmapheresis treatment right away. So I was very lucky that I had that connection. Otherwise, I could have had a lot more permanent damage. I was lucky that most of my damage was reversed. In my left eye is still 20/20, and my right eye I can still see out of it. I'm very lucky. It's just a little hazy. But without that connection, I probably would have probably been permanently blind in both eyes if I hadn't have gotten, because it was so severe, so fast. So yeah, it's great to have advocacy and for doctors to know about this. So, especially young med students, like my first neuro-ophthalmologist, if he had any inclination of what was happening, I would have gotten a much faster diagnosis.
So for me, when I first started presenting, I was living in Florida. I had just graduated high school and I was working part-time. I started feeling a pain in my shoulder that sort of radiated down to my fingertips. And I bounced around from doctor to doctor for the rest of June and July. I went to my primary. He was like, maybe you broke your wrist at work. So I went and had an x-ray. Nothing was broken. I went back to him and he was like, well, maybe it's a muscular thing. So they sent me to a muscular specialist. He was like, there's nothing I can do for you. It's not me. Sent me on my way. I had a neurologist at the time because I've suffered with migraines. My migraines run in the family. And he looked at me, had me walk, sent me to do an MRI, looked at the MRI, was like, I don't know. Maybe you have rheumatoid arthritis. So then I went to another doctor, a rheumatologist, and finally he said, let me send you for another MRI, a full body MRI. I went for the full body MRI and he was like, okay, this is not me. I see something in your brain. It looks like a tumor. He called in the neurologist that was in his office. He looked at it and he was like, you need to go to the hospital right now. I went to the hospital and luckily, they communicated with specialists in different hospitals. And that's when they started talking about NMO. But before that, I would go back and forth to the ER and I had the vomiting and the hiccups. I couldn't keep anything down. I couldn't keep water down. I was vomiting water at one point. And so they just hooked me up to an IV, gave me some fluids and sent me on my way. That was it. And even now, I think a lot of primary care physicians, it's much better here in Canada, I have to say. A lot of primary care physicians, when you tell them like, oh, I have NMOSD, they're like, huh? I've had doctors look at me and say, I got to Google that one. Give me a minute. And literally Googled it as I'm sitting in his office because they don't know. And so I think the knowledge for the medical community is gotten better, but it still has some ways to go. You go to the ER and they're like, why are you taking all these meds? Like, you look fine, you're 25. Why are you on all this? And then you tell them and they're like, I think I heard about that in med school, but I don't know anything about it. I've had to explain it to doctors before. Like, doctor was like, what is that? Tell me. And so having the knowledge yourself, and again, advocating for yourself is so important because you will run across doctors that don't know what's going on. Hopefully not in the future. Hopefully it gets better. But being able to advocate for yourself and say, I have this, I take this for this, and that's why, being able to communicate that with that goes back to friends and family sort of question, but also with your doctors is so important. And that's how you make sure you're on the right line of treatment sort of.
Because I've been diagnosed recently, I think that the education's out there with the doctors and neurologists. So it was pretty easy for me. Like if I had gone to my GP, I probably would have had to wait longer. The GP would have sent me to Toronto because I'm up in Peterborough. And then the wait would have been like 2, 3, 4 months for me to see a neurologist. But because I went to the ER and that's the only way I could be seen with the neurologist in Peterborough. And luckily she was an MS specialist. Her name was Dr. Christine Tompkinson. And so once she did all my tests, my blood work, my lumbar puncture, my MRIs, she had sent them to Toronto as well as Western to colleagues just to confirm that I had NMOSD.
Thank you for sharing those powerful stories. So I wanted to hear a little bit more about how all the advances in understanding and treatment of NMOSD and MOGAD, what have they meant to you personally? And if you feel like the advances haven't reached you, that's okay too. Please share that.
Dr. Dalia Rotstein knows that I'm very stuck on rituximab and I'm very terrified to try anything else. So although I know there's a lot of new medications and new treatment plans, I will say it has not affected me as much because I've not been as open-minded to try anything else. Not that there's not stuff out there. I just really like rituximab and I do have a little bit of like post-traumatic stress to go off of it to try anything else. And I'm sure it's similar with like a lot of other people when they find something that works, they don't want to go off, even though there's something else out there that might be better, that has better results. You're kind of just stuck on the one thing, and that's where I'm at. So I'll leave it there. But I do know there's a lot of other treatment plans and stuff like that. I just haven't tried it.
So for me, because I'm seronegative, there's not so many treatments out there for me. So poor Dr. Machili, she knows how much I hate prednisone. And, she wanted me to stay on 5 milligrams. And I said, absolutely not. I made her taper me off early against her wishes, of course. She was supportive, of course, but I just hated it so much. And I really wanted to come off of it. So I did taper off early against her wishes. But yeah, I hated Imuron because I was so nauseous all the time. I was throwing up anytime I smelled something that grossed me out, I would just run to the toilet and have to vomit. It was terrible. It was affecting my life horribly. And it just made me feel terrible. So that wasn't fun. So I was happy to be able to come off of that medication. And now that I'm on rituximab, it's great. Like I wouldn't want to come off of it either. But I don't know what my next plan would be if this, if I had relapsed on this or if it was affecting me. I don't know what my next step would be. Dr. Machili kind of just said, what, let's not worry about that until we have to. But I would love for more drugs to come out for specifically seronegative, because unfortunately, it's great, obviously, that new drugs have been coming off, but it has been more geared towards the antibody positive. So it'd be nice for me just in the future to have a little bit more security, knowing that, okay, if rituximab does fail, what is my next step? And if that one doesn't take, what's my next step after that? So that is a little bit worrisome for me, but I try not to think about that. So.
When I first got diagnosed, I was on Cellcept. They didn't even know about rituximab, the doctors who first diagnosed me. And they definitely didn't know about, the 4 that are geared towards NMO. And eventually Cellcept does not have, what they told me, does not have good long-term effects. So my new neurologist, who was also in Florida, wanted to stop me on that immediately. And then I was on rituximab for about a year and I relapsed. And it was 2019, so around the same time that the newer drugs started coming out. And my neurologist looked at me and he said, I want to put you on Enspring, but it's going to cost you out of pocket about $500,000. This is in Florida. And obviously, I'm a student. I have 2 great parents. They are both working, but that's not possible. And that's when I was like, I got to move back to Canada. And I moved back here and I also have Dr. Machili. And she was like, okay, before we get to Enspring, let's try Solaris. And I was on Solaris and I had horrible migraines. My migraines that I've always had got 10 times worse and they were every single day. And I was like, I cannot function as a person, let alone a student with a migraine every single day. So we stopped that and we finally got Enspring, finally got it approved. So I'm very grateful for these advancements. And I hope, I've been stable since I came off rituximab. I have not had a relapse, luckily, somebody knock on wood. But I hope that we continue to, as we, things like this also help. Hearing from different patients, I'm sure, a lot of these doctors will go back and say, what did I learn today to better for my patients? And I think that's so important, especially, with the grants that we get, so we can continue to grow. I take the Enspring once a month. Let's, grow from that. And maybe I don't have to stick myself once a month, but just to continue, I'm sure a lot, like they said earlier, a lot of the doctors, this didn't exist when they first started in their fields. So clearly we've made some amazing enhancements and developments. And I hope we continue.
So I'm on a new drug that has just been, as far as I know, was just approved in Canada last year. So Uplizna is the infusion that I take every 6 months. It's $135,000 a treatment. So, and I need it for the rest of my life. thank God for our healthcare system and the Trillium Health benefits they look after it for me. And just to let you know, I have 10 lesions on my brain and 2 lesions on my spine, and I am APQ4 positive. So those won't go away. So I'm very fortunate that I was able to start on this new drug, and I have been pretty positive with it. I don't have very many side effects with it. After treatment, I feel like I have the flu for a couple of days, and then that's about it.
Thank you for sharing those important pieces of information. We're going to close off with a final question. Looking forward, we kind of talked about where we've come so far. Looking forward next 5 or 10 years, what are your hopes for medical treatment, for personal, symptom management, anything that stands out to you in terms of the future?
Right now, like I said, I'm on rituximab and I'm really enjoying it. Although I think, as we all know, I think one of the huge, I don't know who else in here is on rituximab, obviously you. So I think one of the huge things that comes along with it is that people do talk about a lot is the kind of side effects where you will get an infection that you have no idea that even existed. You'll get something happen. I had stuff happen with my eyes, and then they were like, oh, there's an infection on your inner eyelid. And I'm like, I didn't even know that you could do that. What are we doing? And so I had to go to so many eye doctors for that. And you'll find that you'll get weird random infections and stuff. And it's just I didn't even know where it comes from. And I hope that later on, they have something that's not as expensive as a treatment. Thankfully I'm covered right now. But hopefully there will be something that comes out that's very similar to rituximab, because everybody said, I don't want to be on prednisone. I don't feel like myself. When people gain 50, 60, 70 pounds, they do not feel like themselves. You don't feel like you want to go out and do things. You don't feel comfortable in yourself. I just hope there'll be something like rituximab that you can just take every 6 months and not have to have such ridiculous immune kind of side effects in that way. And then along going with that, I hope that there'll be something to help with the fatigue, because fatigue is really, really horrible. And I'm sure a lot of us have to deal with that. Sorry. There is a medication that I take for that, but I try not to take it as much to just not be as dependent on it. Because when I am on it, I don't know why, but it makes me feel depressed almost. So I just try not to take it. But I find that things going along with that is I work out a lot. I'll work out sometimes 4 and 5 times a week. Even if I don't really feel like I want to, I'll just go and do it just to get my energy up. And I do feel after I do that, it does help my energy a bit. But I hope that there's something down the line to help with that won't have any side effects. And yeah, I just hope that a lot of the things that come out don't have really horrible side effects, because that's all what we want. So yeah.
Well, I guess in 10 years, I would love a cure. Girl can only dream. That would be great. But I guess, we need more funding, of course, and more time. So that's fine. But like you said, I would just love more medications and with less side effects, something that doesn't affect your whole body so much, where you don't have to worry about getting sick and getting random infections. And obviously, as we age, I'm young right now, and if my body can kind of handle an infection, and when I'm 70 years old, it might not handle it so well, which, that's always scary. So any kind of medication that will not affect your immune system so much, if there's no cure.
To piggyback off that, but also take the flip side, I hope that there's more awareness by then, and not just with doctors and patients, but with the general public. One of my biggest issues right now with school, and I'm in the midst of writing a petition, I want to end mandatory classes. Because when classes are mandatory, students come in even when they're sick. And that puts me at risk. I got the flu in early September because somebody came to class, because classes are mandatory. But I feel and I had hoped COVID would have pushed it, but clearly I need to push it some more, is that don't come if you're sick. And that's so easy to say. But again, when class is mandatory and part of your grade, they're still going to come. That goes same when, if you're working, people come to the office when they're sick. I'll do that. And then again, with infections, like I'm going to get an infection because you had to come to class. And it's very difficult for me to stress this because again, they will look at me and say, you look fine. I don't see an issue. What is the problem? I don't walk with my cane anymore. People look at me funny when I have to take the elevator at school. They're like, what's wrong with you? Just take the stairs. But you don't see what I see, they don't see the difficulty, the fatigue, the swelling, the pain, so I just hope that in the way people, you mentioned MS, multiple sclerosis, people tend to recognize those names. I want people to recognize MOGAD. I want people to recognize NMOSD. I want you to hear that and be like, okay, I know what that is. And I know how to, obviously, I don't expect you to come to me and, oh, you should try this, this, and this, I don't expect you to know everything. I didn't know everything. But to just come to me with understanding and understand that people are all different in the way that, we take diversity. There's also diverse populations of, I'm immunocompromised, you might be fine. Our immune systems do not work the same. And I want you to understand that just because I don't look like a baby or an old lady doesn't mean that my immune system is functioning as a 25-year-old immune system should. And that's my hope and a cure.
For me, I think, again, piggybacking education, especially in the ER departments. So because I'm on this new drug, I do have a card that states that I have NMOSD and has the name of my neurologist. So then when I do go into the ER clinic, I can show it to them and they can contact my neurologist right away. Just little things like that can help a long way. I think with what I'm learning with NMO, there's a very broad spectrum of different, different symptoms. Some people affects their eyes. Some people it's paralysis. So I think education in the future, and especially in the ERs, would help a lot.
So thank you. I want to say thank you so much to all of our panelists. Thank you for your honesty and thank you for sharing your hopes and your fears for the future. It takes a lot of courage to be up here, but I think we've all benefited from hearing about your experiences, and I'm sure a lot of you have similar stories to tell too.